Welcome back to the David Pakman Show.
Welcome back to the show. I want to say hi to a brand new David Pakman Show member, Shane Karras. Welcome, Shane, to the show. Great to have you aboard here. You can go to davidpakman.com/membership to find out more about becoming a David Pakman Show member. You can also support the show for free by doing your Amazon.com shopping through the black banner at davidpakman.com. Thousands of items, Lewis, being shipped through that, and it's really becoming a huge help to the show. So thanks to everybody who does that.
Absolutely.
What's the last item you bought on Amazon through that link?
Let's see. I don't think anything. I just don't really buy stuff off Amazon.
Oh, you're more of a... What sites do you go on?
I don't really buy things online.
Oh, is that right?
Yeah. I just, don't do it.
All right, there you go. You've heard it here, folks. The Supreme Court is hearing healthcare arguments right now. And the healthcare reform bill has basically been appealed all the way up to the Supreme Court. And we now have a new map, Lewis, which is fascinating, which we have up on the screen now, which actually shows which countries have the which states have the most and least uninsured people. And it's fascinating that the states that are much more likely to have opposed the healthcare reform bill, typically Republican states, are actually the states with the biggest healthcare problems, Lewis. As you can see, many of them in the southeast of the United States, in the south, Idaho and Wyoming and Montana. Any surprise about this? I mean, it continues along this line of people voting against their own best interests, specifically putting in Republicans into office who enact policy or prevent policy from being enacted that actually would help people. I'm not surprised. We've been covering this for years.
Yeah, and they just eat up all the misinformation they're fed, and they're afraid. They're afraid of what will happen financially. But
is it a fear thing, you think?
It's got to be in some ways, because you've got you remember death panels,
right?
I mean, come on. There's fear-mongering all over the place.
Yeah, but Natan, do you think it's fear or is it brainwashing? I mean, it could be brainwashing not to be afraid, but just to believe that this is not policy that makes sense.
Who's being brainwashed?
The people who continue voting in politicians that enact policy against their own best interests.
Yeah.
As far as education, healthcare, and economic policy.
I mean, the argument here with the healthcare thing is whether it's unconstitutional, not whether it's good.
No
one is talking about whether something unconstitutional could be good.
Even if it is unconstitutional,
exactly.
You're saying. Well, that's a whole other... That issue is not going to play well because...
But that's actually one of the arguments that's being proposed, is that this is going to ensure so many more people and be so good for the country that it can't be unconstitutional.
Because
that's kind of the argument that some people are making.
Yeah, Republicans aren't buying that. And my point is that it's Republican attorneys general and other Republican legislators who have been pushing the idea that the mandate is unconstitutional.
Yeah, but you know why they're rushing to do this now. It's because once the law is enacted and people benefit from it, there's going to be a huge constituency of people that don't want the law to be repealed at that point.
Well, one of the debates in the Supreme Court, Lewis, is depending on whether, and this is such a semantic argument that started yesterday, depending on whether the mandate, the fine, the penalty is a tax, the Supreme Court may or may not be able to actually decide on this until people start paying that penalty/tax for not being insured, which wouldn't happen for several years still. If that's the case, that's the scenario Natan is outlining, which is once this gets going, assuming it does work as well as many think it will work, it's going to be much harder to repeal this thing.
Yeah, but you know what? Neither of the two sides want that to happen. And that's why I didn't check the news this morning, but the judges probably ruled that they're going to rule on it now.
I think that is the way that it's going.
Yeah, I mean, ultimately, this is not the best way to do it. Obviously, the best thing is everyone is covered, regardless of of what state you live in.
Single-payer health care, national health care.
There wouldn't need to be a tax or penalty.
I agree with you. And you know, my real concern is, Lewis, you know some of the good things that this bill does. I know, the audience knows, okay? The problem, the real question is, does this bill get us closer to potentially going to single-payer health care? I don't really think that it does.
It doesn't make us move further back.
You don't think so? I think it does in one sense, which is it's putting more people into the for-profit healthcare system. And I just think as a sheer numbers game, the more people that are in that system, the more difficult it will be to move away from it. Just as a sheer mathematical thing.
I can understand that. Could be.
We'll continue to watch this. I'm very curious. Yeah, go ahead, Natan.
Yeah, I was just going to say, this whole issue is basically like a complete owning by the Republicans of the Democrats. The only reason why the Democrats proposed a mandate where everyone needs to buy insurance, which, by the way, was a Republican idea.
Of course.
The only reason why they did it is because it was totally not feasible politically to support a single-payer system, which is totally constitutional and which would probably make a lot of sense. So they support something that's farther to the right, and what do they say? Oh, no, you can't do this because it's unconstitutional. But what else can you propose?
Well, of course, you can propose complete takeover by the corporate world of healthcare in every single way. If you have pre-existing condition, you're not covered.
So the status quo ante, basically.
The status quo exaggerated, exactly. That's what you can propose.